Today, we are going to address something that I feel has been ignored, what women aren't being told before they're starting a GLP-1. Hair loss and thinning. This can happen in about 6% of people, and it depends on two things. Number one, if you are having rapid weight loss, which is more than 1 to 2 pounds a week, that increases the risk of hair thinning or hair loss. And number two, if you're on it for long term, that means more than 6 months. So when there's rapid weight loss, it can cause nutrient deficiencies, hormonal imbalances, and stress, which all contribute to hair shedding. The second thing women are not being told about is bone loss. Here's the thing. GLP-1s can put women who are postmenopausal at risk for losing bones, and menopausal women are already a group that's at increased risk because our estrogen levels are decreasing. So if you have a personal history of a fracture, you have a family history of osteoporosis, or you already have osteopenia or osteoporosis, it is crucial that you discuss this with your healthcare provider. If you haven't already started a GLP-1, I strongly suggest getting a baseline DEXA scan so that you know where your bone levels are before starting. And if you're already on a GLP-1, it's definitely time to have a discussion about how long you're going to be on the medication and what's your exit strategy. Third, let's talk about muscle loss. You may know a little bit about the muscle loss that can be experienced with GLP-1s, but here are the facts. Definitely, you're going to lose weight on a GLP-1, and you will lose fat, but up to 30% of the weight loss is muscle, and it's incredibly hard after menopause to regain that muscle. So the last thing that I really want to address that I don't hear anyone talking about is the need for birth control. Yes, GLP-1s like Ozempic are category C for pregnancy. What does that mean? It means that there are not enough human studies done with women and GLP-1s to rule out harm. But we do know that in animal studies, it has been shown to potentially cause birth defects and miscarriages.
So Dr. Marianne, how do you combat those side effects of GLPs?
Well, here's the biggest problem is that, especially with muscle loss, it's a double whammy. Number one, you have less appetite. So you're not going to have a lot of motivation to eat a ton of protein. So it's hard to get in the right amount of protein. Secondly, the most common side effect of GLP-1s is nausea and vomiting, which causes you to be super tired. Are you going to want to go to the gym and lift dumbbells when you're fatigued? Absolutely not. So the only way to combat these side effects is, number one, being on the right dose of GLP-1s. I am not a fan of ramping up the dose quickly like a lot of protocols actually are determining for patients. This should be patient-focused. If you're having a really good response on a low dose of Ozempic, there's absolutely no reason to crank up the dose. So that's the first thing. But I think the second thing is before starting these medications, you already have to answer the question of how long do I want to be on this medication? And again, the safe way to do it is to already have a good nutrition plan in place where you know, okay, these are quick, easy proteins that I can have. And a lot of times you may have to resort to a protein shake. It's a lot easier to consume protein in liquid form when your appetite is low than to actually have to eat an entire 6 ounces of chicken breast. And then when it comes to exercise, I know a lot of people feel like, well, if I can't go to the gym for an hour, why bother? And I'm going to tell you, it all adds up. So even if you're taking a 5-minute break from work and you put some dumbbells next to your desk, Even that is going to help. Anything helps. A 10-minute brisk walk helps. And if you want to, put on a 10-pound weighted vest for extra benefit. So there are ways to combat it, but I feel the biggest miss is these aren't being addressed before someone starts these medications. So here's the bottom line. GLP-1s can be a game changer, especially for controlling blood sugars and losing weight. The real hack is this. You need to have a conversation with your healthcare provider so that you can make the best informed decisions. You need to know about all of these side effects. So then you can decide, is it the right drug for me? How long should I be on it? How do I get off? If you have any other concerns or questions about GLP-1s, please drop it in the comments below. This is a conversation that we have to have in the open, supporting one another, because I want to make sure that you have all the information that you need so that you can be on these drugs in the best, healthy, and safe way. Please, as always, like this, subscribe to the YouTube channel, share this with a girlfriend who needs to know this information. Now that I know better, I do better, and I want to help you do better too.